So we are live now, sir, and I'm starting. Greetings and warm welcome to everyone. I am Momita, the assistant moderator from Clirnet. It is my sincere pleasure to extend a heartfelt welcome to all the delegates joining us from across the country. We are indeed fortunate to have the valuable support of esteemed doctors, and I express my gratitude to each one of you for dedicating your time to be with us today. Allow me a moment to introduce our platform, Clirnet. It stands as one of the largest and digital CM platforms in India, providing a space for doctors to create and share medical content. So now I would like to extend a special welcome to today's distinguished speaker, Dr. Khaja Javed Khan. Dr. Khan, MBBS, MD, FIPP from USA, EDPM from Europe, and FIAPM and CCEPC is a distinguished pain management specialist. As the director and consultant at Algos Multi-Speciality Pain Clinic and Algos Academy of Medicine, Dr. Khaja Javed Khan brings a wealth of expertise to this field, particularly in interventional pain practices. So, Dr. Khan will be sharing his insights on the topic approach to knee pain. So, before begin with today's topic, I would like to give a brief about this. Knee pain is a frequently encountered issue with numerous potential causes. It is crucial to rule out urgent conditions and determine if a referral is necessary while assessing a patient with knee pain. Key elements of the patient history should include age, pain location, onset, duration, and quality, any associated mechanical or systematic symptoms, history of swelling, details of any participating trauma, and relevant medical or surgical background. Radiographic imaging is generally reserved for chronic knee pain or acute traumatic pain in patients who meet specific evidence-based criteria. So now, without any much delay, I would like to hand over the session to you, sir. You can proceed. Thank you.
A very good afternoon to one and all attending. So, at the outset, I'd like to thank Clirnet for the opportunity to lay emphasis and throw more light on this topic of approach to knee pain. Myself, I'm Dr. Khaja Javed Khan. I am a consultant anesthesiologist and a practicing pain physician in Bangalore. So, I'm the founder director of Algos Multi-Specialty Pain Clinic and Algos Academy. So, with this brief introduction, I'll just go into the session itself. So, do let me know once my screen is visible. Is my screen visible?
Yes, sir.
Okay, thank you for the confirmation. So, today's topic is approach to knee pain. We'll be doing today's topic under the following headings. We shall start with a brief introduction, and then we'll look into the risk factors for knee pain, a brief anatomy of the knee joint, the different causes for knee pain, the different investigations, what we can do, and the treatments, and along with how pain medicine plays a role in taking care of the approach to knee pain, and finally, the conclusion. So, knee pain is a very common entity, and a lot of patients come to our medical clinics and OPDs and hospitals complaining of knee pain. So, one thing what we have to keep in mind is it is not just a disease, it's a wear and tear which happens, right? And everybody at some point of the other, they will tend to develop knee pain. Okay, as is very much evident with the cartoon in the picture over here, that which says be kind to your knees. You need them as you get older. So most of the body weight is brunt by the knee joints, and we have to be very careful to be sure that our knees are taken good care of so that they don't become a problem in the future. Now let's have a look at the various risk factors for knee pain. one is age. Okay, as you grow old, then what happens is knee pain becomes quite common due to the wear and tear of the cartilage, okay, and the bones in the knees. It's more common in females compared to males due to a host of factors. Okay, could be hormonal. Okay, could be the postmenopausal osteoporosis which sets in as well. Obesity is a very important risk factor because it lays more weight over the knee joints and cartilages. Low calcium and vitamin D levels are prevalent quite a lot in today's day and age, and those can be important risk factors. Previous history of knee injury or knee surgeries can also be a reason. Okay. So basically, after looking at the different risk factors, what you have to understand is, what are the different structures present in the knee joint, which can lead to a problem. So we are seeing over here, knee joint is formed by articulation of two bones, that is the femur and tibia. Patella is also there in the front. Okay. Different ligaments to stabilize the knee joint, like anterior cruciate, posterior cruciate, the menisci, the collateral ligaments, etc. And what is very important is the knee cartilage. Knee cartilage is that white structure, what you're seeing, okay? And that tends to develop wear and tear, resulting in osteoarthritis. So what could be the different causes now? One is injury to the knee, okay? Could be a very important cause when you are approaching a patient who's coming to you with knee pain. Find out if there is any history of any injury, okay? Could be a post-traumatic, an accident, or even a sports injury, which can lead to such problems. Inflammation, okay? Now, usually the tendons, the ligaments, whenever there is wear and tear, tend to develop inflammation on exertional activities. What would be exertional activities? One could be even climbing the stairs, climbing up or climbing down, or standing for a long period of time, walking for a long period of time. All of this can lead to inflammation and pain. So, one very important thing is an effusion. Okay. Many patients come to us with complaints of knee pain along with swelling of the knee joint. Now, the swelling could be due to a lot of causes, and one common cause is something called knee effusion. Now, this knee effusion is common in patients suffering from inflammation inside the knee. Could be an arthritic condition, okay, leading to kind of a boggy sensation in the knee joint. So, we just spoke about arthritis. So, let's have more further look on what exactly is arthritis. So there are two kinds of arthritis. One is rheumatoid arthritis, okay, which is quite prevalent in the younger population. If you look at a comparison over here, you can see that the cartilage tends to develop breaks, okay, wear and tear, leading to reduction in joint space, friction, and inflammation of the synovial membrane, leading to erosion of the bone and swelling or inflammation. You can see it's a red knee, swollen knee, okay. Now, rheumatoid arthritis is not just, limited to the knee joint, can occur in other joints as well. Okay. Mechanism is the same. Synovial membrane getting inflamed, okay, leading to pain and swelling. Could affect the small joints in the hands, the feet also, okay, the shoulder, the elbow, the wrist, etc. Now, coming to osteoarthritis. So, osteoarthritis, again, similar to how it was leading to a damage. Thing is, the inflammation is not as high as compared to the rheumatoid arthritis component. Okay, but definitely there is wear and tear in the cartilage due to aging. You can see over here, okay, the exposed bone is seen, the cartilage breaking down and eroding. Meniscus and bone spurs are also seen. There are different stages of osteoarthritis. Okay, as you can see, as the stages progress, okay, then what happens is the damage to the cartilage is increased exponentially. So one thing what you have to remember is investigations play a very, very vital role in for us to approach knee pain and to define what exactly is the cause for the knee pain, because unless you know the cause, you're not able to go into the treatment so well. Okay. So blood tests play a very vital role. Blood tests could include CBC, ESR, CRP, the arthritis profile, RA factor, anti-CCP, etc. Calcium levels, vitamin D levels, etc. X-rays are very important. especially for classification of the knee joint stages of arthritis. We have something called as a Kellgren-Lawrence radiological staging system for the knee osteoarthritis. Okay, there are different stages. That's the four stages are defined. And in this X-ray, you can see a comparison between normal knee joint and arthritic knee joint. What are the first things you're seeing? One thing is the joint space is reduced. You can see a few bone spurs as well. Okay, you can see irregularity of the joint margins also over here. And along with that, a deformity, either a varus deformity or a valgus deformity, depending on the type of osteoarthritis. Ultrasound plays a very vital role, okay, especially in our practice. So ultrasound helps in diagnosing any soft tissue, soft structures, which are the pain generators or causing a problem. Okay. MRI, again, very important, the best to identify any tears, because due to injuries, either a trauma, sports, or accidents, ligaments can undergo a lot of tears, menisci can undergo tears. So MRI helps us identify them, whether it's a partial tear or a complete tear or injury. Now let's have a look at the treatment part of this. Most important in treatment is conservative management. Conservative management can help take care in more than 50% of patients with knee pain. And among the conservative treatments, one of the most important things is weight loss. Why weight loss? Because more the weight, more stress over the knee joint, more pressure. Okay. Conversely, if you think, reverse it off, less weight resulting less stress over the knee joint, less pressure over the knee joint cartilage, less erosion, and hence less pain. Diet is number one in weight loss, okay? And make sure that your diet contains a good amount of healthy fats, okay? A good amount of proteins as well, a lot of veggies, so that you are in the right shape and right weight. These are a few foods which are good to help fight inflammation. You have fish, avocados, salmon, prunes, berries, yogurt, spinach, omega-3 supplements, fibers, turmeric, beans, etc. Good source of calcium are very important to have in your diet. They include almond and dairy products, orange, soya, peas, beans, fish, meat, broccoli, etc. And good source of vitamin D include orange juice. Most important is sunlight, right? The body itself makes vitamin D when exposed to sunlight. Egg yolk, cod liver oil, fish, caviar, fish eggs, mushrooms, etc. Now, exercises are also very important because the more active you are, the more active your body is, right? So walking is a very good and one of the best forms of simplest forms of exercises. Okay. Knee strengthening exercises. Okay, you can see strengthen the quadriceps and hamstrings, etc. You can see this. Okay, this is the resisted band exercises, leg raises, etc. Coming to medications. Medications, of course, have their role, but medications are not the only treatment for people suffering from knee pain. Surgery, again, if nothing helps, then surgery, total knee replacement or arthroscopic surgeries to help, repair the ligaments, etc. are done. Okay, again, this is for last stages. So here you can see in the, this is the post TKR or knee arthroplasty of the femoral component, the typical component and the spacer in middle as well. So now we saw conservative management, we saw surgical management. Now, how to deal with patients or how to approach patients with knee pain whose pain is not responding to either medication, so surgical management. Is there an alternative, right? Because it becomes a gray area. Many of the time, patients have knee pain, they're taking medications, doing physiotherapy, but that's not reducing their pain. And next option is surgery, but they don't want to undergo surgery, or they're not in a position to undergo surgery due to some ailments, right? So for such patients, what do you do? Do you just leave them suffering in pain? Well, there are definitely options and alternatives, and that is what I specialize in, that is pain medicine. So answer is a yes, there are alternatives, and the answer is pain medicine. So let's understand what exactly is pain medicine. Okay. Remember, pain medicine as such is a super specialization. So I told you in the beginning, I have done my MBBS and I'm an MD in anesthesiology. Post anesthesiology, you have different super specialty options like cardiac anesthesia, neuro anesthesia, critical care, etc. And pain medicine is one of the upcoming fields, okay, after anesthesiology as a super specialty branch. So what exactly is pain medicine? It's a super specialty branch, as I mentioned, like for example, cardiology, neurology, urology, diabetology, etc. Pain medicine basically is a branch which is quite new. Now, many doctors themselves are aware that there exists such a branch. So, what do we exactly do in pain medicine? We do nothing but we stop the pain, if you have to tell in layman terms. So, we were speaking about knee osteoarthritis, right? The different stages. So, we are seeing that grade 1, grade 2, you can see a little bit damage to the cartilage happening. Grade 3, moderate, more damage. Grade 4 is severe. You can see a lot of damage there, right? So, depending on the stage what it is there, we have different options of treatment for example, patients in the early stage, like stage 1, stage 2, then regenerative or repair options are a very good management protocol. So one such thing is something called as PRPs. I'm sure many of you have heard of the term called PRP. PRP is platelet-rich plasma. Okay. And it is injected inside the knee joint. It helps heal the cartilage. It helps heal the partially torn ligaments and tendons as well. Not the completely torn. Completely torn have to undergo arthroscopic surgery. Okay. This is platelet-rich plasma. The platelet-rich plasma, remember, how is it obtained? It's obtained from the blood, whole blood, uh, and a centrifugation process is done wherein platelets are separated out. So if you see blood components, 93% are RBCs, 6% platelets, 1% WBCs, and plasma is, of course, a liquid component. PRP has 94% platelets and plasma and 5% RBCs. So you're seeing that the concentration is more. So this is a vacutainer post centrifugation of blood. You can see it's got separated into few layers. What are the layers? You can see one topmost layer, platelet poor plasma, kind of yellow. Below one, platelet rich plasma in the middle of red blood cells, and platelet poor plasma is PRP, or platelet rich plasma. It looks a bit golden yellow. Other options include something called as visco gel injection. This is nothing but sodium hyaluronate or hyaluronic acid injections injected inside the knee joint. They are like a visco supplementation or a viscoelastic substance, which provides the necessary lubrication to the knee joint, okay, so that it helps in better walking and also decreases the pain. So this is a knee PRP, okay. As I told, we take from the blood of a patient, centrifuge it, and we prepare it, and this is me injecting the knee PRP. This is using the X-ray machine. This is using an ultrasound machine. This is using the X-ray machine. Okay. This is how it looks under the X-ray machine. You're putting in the needle inside the knee joint, injecting a bit of dye, confirming that you are in the right place, and then injecting the PRPs. So that was for early stages of osteoarthritis of the knee. I told you stage 1, stage 2, to an extent stage 3. But what to do for knee OA last stage, like stage 4? I told you stage 4, it is only surgery. Knee replacement surgery, what is the best option? But for patients who cannot undergo surgery or don't want to undergo surgery, are there options? Yes, there is options. Okay. Definitely there is hope. And that is a treatment called radio frequency ablation. This RFA is a procedure called, which is US FDA approved, utilized in patients suffering from chronic knee pain, okay, and who cannot undergo or don't want to undergo surgery. So does this do? This targets the small nerves around the knee joint. We take the pain signals and temporarily blocks them. So this is me doing the RFA procedure, okay. This is using the ultrasound guidance, okay. Where in this procedure, what we do is we identify those nerves around the knee joint and we're going to temporarily block them. Okay, this is me doing the procedure again with the RFA machine. It's a small video. Don't know if this will play. Hope the video is visible. You can see this is an ultrasound, okay, and Doppler is put, and you can see that color coming, the pulsating thing. That's nothing but the artery, genicular artery. Okay. Remember, the nerves follow the vessels. Okay. So the nerves are close to the artery, and close to the artery is where we do the radiofrequency ablation. So this is the RFA needle. Okay. You can see that pulsating the thing over there. Okay. And then the needle going through so that it is producing the region. Okay. Coming to the advantages of the pain management procedures, main advantage is they are all daycare procedures. No need to get admitted like surgery and all that. Back to work as early as possible. Okay, not no long leave from the office. There's no surgery being done over here, and everything is done under image guidance vision. So the rate of complications is almost nil, negligible. Then under local anesthesia, even if the needle before the needle is put, anesthesia is first given and then only needle is put. Okay, so that the pain is as less as possible. Even though it's a simple prick for the patient, it is definitely technically challenging for the doctor. So to conclude, I would say that knee pain is a very common condition. Okay, the notion which people have that I have to bear with the pain is totally wrong. Pain needs to be taken care of, and if the pain needs to be taken care of, then the diagnosis is what is very important. So whenever you approach a patient with knee pain, try to get to the right diagnosis first, and then treatment will accordingly follow. Thank you very much for the opportunity. Clirnet, I conclude my presentation.
Thank you so very much, sir, for this comprehensive talk and wonderful deliberation. And you have the topic as well. However, due to doubts on some points, our delegates have raised few questions. So may I have your permission to put them across, sir?
Yes, please.
Thank you, sir. You can read out the question and answer accordingly. Is my screen visible to you?
Is this whole
Thank you, sir.
started screen sharing? Not yet seen. Yeah. Okay, one have metabolic conditions like diabetes or hypoglycemia been evaluated as potential contributors to patients' knee pain? Yes, definitely. Diabetes and hyperuricemia. Hyperuricemia usually lead to a condition called gout. Okay, and that can lead to more pain over the feet or the big toe region. But for the knee pain also, it can lead to a formation, especially if there are any formation of crystals or something. And diabetes as such, yes, we do get diabetes also causing to knee pain conditions and everything. Okay, and they need to be evaluated and they need to be under control. And all of this comes under the arthritis category only. Next question. Has a sentinel analysis been conducted to detect inflammatory or infectious agents? As I told you, whenever there is fluid inside the knee or a swollen knee, then definitely we aspirate the fluid out and we send it for analysis. Okay, whenever synovial fluid analysis is done, then we get to know that what is the cause for the accumulation. Is it an inflammation or infection? If it's a septic arthritis, then it will be infection. If not, if it is sterile osteoarthritis, then it will be an inflammatory tap which will come out. Next question.
Thank you so very much, sir, for answering all the queries of our delegate doctors. And thank you once again for your valuable time and being with us on our platform and sharing such a valuable insights. So finally, I would like to request to all our delegates, kindly let us know if you have any other topic based on today's specialty. We would be very glad to organize a session on that particular topic. And to stay updated with more medical information, do follow our Facebook, Twitter, LinkedIn, and Instagram pages. So till then, sir, take care and bye. Thank you.
Thank you.